Coming up, we'll be on location at Bethesda Chevy Chase Oral Surgery in Chevy Chase, Maryland, discussing the latest advances in oral surgery and how they can help improve your oral health and give you the beautiful smile you've desired, with one of this area's top oral surgeons, Dr. Jared Abel. Welcome, Dr. Abel. We're excited to have you on the Top Doctors Interviews program today.
Thank you for having me.
All right, you're recognized as one of this area's top doctors. You do great work in the community, so we're going to talk about dental implants to start with, because there's so many advances in that specialty, and people really don't know that the process and the level of discomfort has changed over the years. It's so much smoother, so much better, and we've got you here to educate the community. Can you please begin by telling us what dental implants are?
Sure, absolutely. I'd be happy to. So, dental implants are an incredible strategy that we now have in our armamentarium to help with people who are going to be missing teeth for a variety of reasons, whether they're congenitally missing them or if they lose them to trauma or decay or infection. And what a dental implant is basically, from our standpoint as the surgeons, is a new root. So they're typically a titanium alloy, shaped like a cylinder screw, and it can bond biologically to the underlying bone, and then ultimately, with the help of the restorative dentist, put a crown on top so it functions just like a tooth. One of the nice advantages too, once it works, is that it doesn't get decay. It can get periodontal and gum recession, bone loss if it's not maintained, just like natural teeth can, but ultimately it should behave just like a natural tooth, and it really works wonders.
That sounds great. What are some of the benefits of getting dental implants as compared to other options?
So typically the options that we had before dental implants were around is, one, you can always do nothing, which is usually not advised. The chewing efficiency isn't as good, and if it's in a cosmetic area, that's not as ideal. So you can go something as simple as a removable partial denture, sometimes referred to as a flipper. It comes in and out, doesn't chew as well, usually doesn't look quite as nice, but is a little quicker method. But then traditionally something that was fixed in place is called a bridge. So if you have a tooth or teeth on either side of the area that you're missing a tooth, you can shave down the adjacent teeth and connect them all and walk across it like a bridge. That's why they call it a bridge. The downside is you have to compromise other teeth that you didn't need to if you could help it. And distribution of forces is not as ideal. So the teeth that are being used are now taking more force and more likely to have issues down the road.
You have a wide variety of types of people that may need dental implants. Can you tell us who a good candidate is?
Well, the fortunate thing is that most people are good candidates, so almost anybody can get a dental implant. The determining factors will certainly be, there's not really an age cutoff as far as how old somebody is, but there certainly is an age cutoff on how young someone is. So we want them to be fully developed, done growing, before we put that implant in, because if they're still growing, then the teeth around them can grow, and the jaw can grow, and the implant doesn't grow with it, so that's not as ideal. But the times that someone would not be a candidate is just if they have certain comorbidities or illnesses that wouldn't allow them to receive that type of treatment. Basically, if they have underlying illnesses or medications that their immune system won't be responding the appropriate way, or if the underlying anatomy is just too far compromised. But almost any situation, we can rebuild and reconstruct the bony architecture and the soft tissue, gum tissue architecture so they can be conducive for implants.
That sounds like a great procedure that can really help a lot of people. What's the patient process that a patient would go through when they would come to see someone like yourself?
So there are a variety of circumstances. Someone will come in for dental implant treatment. So if they still have a tooth in place that's going to need to be removed, there are a couple ways we do it. The most common is we remove the tooth and remove any underlying infection or pathology, and then we can recreate the bone anatomy by just doing a very simple bone graft procedure at the time of extraction or removal of the tooth. Wait a few months for that to get integrated and solid bone, and then we can place an implant in a good solid foundation. And then typically it's it could be anywhere between a 6-week to a few month process for the integration process of that implant to the underlying bone. And once we confirm that it has integrated, the restorative dentist starts making the tooth on top. Now, another option that is sometimes available to us is that at the time of tooth removal, we can put an implant in at the same time, and then it's only one procedure instead of multiple procedures, and then after just a few months, that can be restored and they can have a functional tooth in that area.
So once a patient gets the implant and the procedure is completed, is there any downtime? Are there any restrictions as far as what people can eat?
Yes, so if it's something as simple as like you want to do a few implants, then typically downtime's not much at all. The recovery is typically very smooth and quick. It's significantly different than even just taking a tooth out, a tooth removal. Even a tooth removal tends not to be too bad, but when it comes to placing implants, it tends to be even smoother as far as the recovery process goes. The eating restrictions, it's just a little bit of a softer diet on the site of where the implant is placed, because we don't want to put any pressure or apply any pressure to that could cause movement and won't allow it to integrate. And that's just for a short period of time. So it's usually 6 weeks to a few months, so just maybe a month and a half or so. Now if we're doing bigger procedures, which we do sometimes, so if we're removing, let's say, all teeth or someone doesn't have any teeth, then sometimes we can place multiple implants and restore that same day with a prosthesis or a fixed prosthesis that will screw down into those implants so they can smile that day with those teeth. Still going to be a softer diet until they integrate, and then once they do, they can go chewing on steaks.
So what type of results are your patients seeing, Dr. Abel?
I mean, our results, tend to be fantastic. The success rates of implants themselves, and this is across the board in good, experienced hands, typically the success rate is 98 to 99%. And that's truly astounding when you compare it to other things that we do in dentistry and other types of healthcare. Is to achieve those success rates is not very commonplace. So something as simple as a filling or a crown or a root canal procedure, oftentimes, they're not getting those same success rates. So when it comes to dental implants and experienced hands, it's really phenomenal.
That is an extremely impressive success rate. It seems like a no-brainer. I mean, if you're in a situation where you've lost a tooth or you need dental implants, with the way the procedure has advanced over the years, I mean, it seems, again, like a no-brainer. Now, how long do the dental implants typically last? I know it could vary from patient to patient, but what would you say in general?
So in general, once they have integrated and been restored in a successful manner, we are seeing that they're lasting decades, if not people's lifetime. Just like anything, though, with enough wear and tear, anything can have a mechanical failure, just like a natural tooth can have a chip, a fracture, or something like that. But it's much less commonplace once they've integrated and been successful. So once we get past that initial integration phase, we're seeing decades.
You do a really great procedure called Teeth in an Hour, and it sounds pretty impressive. I mean, to be able to go in and get your teeth in an hour, I mean, is that literally what we're talking about?
Yes, in select circumstances, that if somebody is already missing a tooth or they have a tooth that needs to be removed, if the underlying anatomy is conducive to place an implant that day, we can do so, and then with the help of a restorative dentist, we can coordinate to place that implant and then restore it that same day. Certainly will not go immediately under function because we need it to integrate still, but it's something that we can smile with, and it can be a great cosmetic result, as well as training the tissue around it to heal ideally for when it's ready for its final restoration.
Outstanding. I mean, I can personally relate to a situation because my sister, who does public speaking, lost a tooth and through an accident, and she really could have used the teeth in an hour, so that's a great procedure.
Yes, we love doing it when it's able to be done, and it gets phenomenal results.
Excellent. Not only do you treat adults, but you also treat children, Dr. Abel. Can you tell us a little bit more about what you do for children here at Bethesda Chevy Chase Oral Surgery?
Yes, so we take so much pride in everything we do, and we believe we shine in almost everything we do, if not everything. When it comes to the pediatric population, this is where I get the most pride. There's no age cutoff of when we'll see and treat kids, so we'll see them as early as 1 day, if they're 1 day old. And our patient population in this practice, it's about 15 to 20% of our patients are 12 years old and younger. We do a variety of procedures for those patients. Usually the most challenging thing for any practitioner to deal with this subset of population is being able to communicate efficiently, both with the patient and the parents. So oftentimes the parents themselves can be the more challenging part, to make sure that we can take their fears and assuage them as much as possible and make them comfortable and get them through this process. Because it's often that there'll be an element of anxiety and concern, not knowing what they're going to experience, and it's up to us to take that feeling and just really convert it into a more positive feeling. We have a facility and a team of comfort, and we get them through this with as smoothly as possible on all aspects. And this is something, from my personal level that I feel like I relate to this subset of the population and our team as well, because, I can only do so much, but our team and our auxiliary staff are absolutely phenomenal in relating to children, their parents, and we just create an environment that's very warm, welcoming, and it is very rare that we have any circumstance where a patient and or parents feel like they had to endure a negative experience to get through this process, and it's overwhelmingly positive by the time we're done.
My son was having tooth pain, and we called the dentist. It was the beginning of COVID, and so his practice was closed, and he recommended an excellent oral surgeon. So we came to see Dr. Abel here. He had an abscess in on his gums, and so they removed the tooth and sent us on our way. So Dr. Abel is an excellent dentist. He's also, has a really nice way with kids. He made Griffin feel comfortable and made me feel comfortable, and just made the whole process easy, and clearly really knew what he was doing.
As a lot of kids do, he started having issues really early and then decided later on, I should probably tell my mom about this. So he said, Mom, my teeth are really hurting, but this is right before he was heading off to college. So I was like, is it hurting bad enough that we need to delay this trip? Or do you want to go and we can kind of just check it out? He goes, let's just check it out beforehand. So we go to his dentist, who said, his teeth are impacted. It's the wisdom teeth coming in. He should be fine, but you should take care of this. So he comes home, during Christmas break, and I said, well, how are your teeth? He goes, oh, totally fine. I was like, are you sure? Because they were pretty bad before. He goes, Mom, totally fine. So a few days before Christmas, he goes, you know what? They are really killing me. I can't even sleep. They're hurting so badly. So, we make it over to Dr. Abel's office, and he says, they got to come out. And I was like, is there any other way you can do it? And he goes, they have to come out. And I was like, all right, let's talk about this a little bit. And the reason being is because I had my wisdom teeth taken out many years ago, and it was a nightmare. I mean, it was like pain, numb tongue. I ended up in the hospital, had to have nerve damage surgery, all this other stuff. So when Dr. Abel is telling me that my child has to have his teeth taken out, I go back to that. And I'm like, is there any other way you can do this? It could be genetic, could be, he could have nerve issues, and he's, calming me down. So he had such this wonderful sort of dual thing going on, right? He's kind of calmed my son and letting him know that the surgery is going to be fine. And he's also trying to calm my own fears, right? Because we all reach back to those. At the end of the day, he goes, he really does have to take them out. And I said, okay, but you got to take care of my baby. And so the day comes, I arrive, Trey arrives, my son is like, he's 18. He's like, Mom, calm down. It's not that big of a deal. I was like, dude, they're about to cut into your mouth. So, we're kind of going back and forth. We go in the back. They have such an amazing staff here. Everyone is calm. Everyone is happy. He's fine. I am amazingly calm as well. They say, okay, Mom, he's out. I come back here into the waiting room. My friend calls on the phone and says, hey, how's it going? And I said, Trey's in the back. I go outside to talk. Dr. Abel comes. It's been less than 10 minutes. He goes, we're done. I was like, what'd you do? So he's standing there explaining to me how, with the process of taking out the teeth, Trey comes out. He looks fantastic. No pain, very little blood. It was the most amazing experience that either of us had in this, what could be, a traumatic experience, as it was for me. And Dr. Abel made it seem like it was just a simple everyday occurrence that just had to happen. We're happy because I think the staff is very professional. Dr. Abel is, he's kind of a big kid, right? So he can handle the kids who come in here who are scared, and he can calm the fears of the adults who, our babies are, don't mess with our children. You know what? We want our children to be happy and healthy, and when they walk out of here, have no fear of the dentist, of the surgeon, of anyone like that. So he has such an incredible team here that when you walk in, you may walk in nervous, but you're going to walk out happy. So I would recommend him to anyone.
Before I came, I had a lot of excruciating pain in my molars. I had my wisdom teeth extracted. It was really easy. It only took a few days to recover. I had no problems and no pain afterwards. It was really easy. Dr. Abel was very attentive and made me feel really comfortable in the area. I recommend Dr. Abel to anybody that needs to do anything to their teeth because he's the best doctor out there.
I was having a lot of pain and pressure in my lower jaw, left side, right side, and it was just very difficult. I had all my wisdom teeth extracted. It was really smooth, really fantastic. Everybody who was here was really kind, and I didn't feel like it was any pressure at all. Dr. Abel was very capable, very accommodating, and his staff was fantastic. And I just felt like it was very easy for me to transition, both before and after the surgery. It only took a couple days to recover, and within a short while I was back to 100%.
I had an implant that needed to be done, and I had some difficulty with one of my teeth. It was an infection that was causing a lot of pain, so tooth had to be extracted and implant prepared for a new crown to be placed in. Well, this was my first implant, and I can tell you that Dr. Abel was extremely impressive. As a matter of fact, it was very smooth, it was flawless, didn't have any problem while he was doing it, as well as didn't have any problem afterward. What I was impressed about was the fact that Dr. Abel was personally involved while he was doing it, obviously, and also afterward, making phone calls, follow up to make sure everything is very smooth and without any problem. The result was outstanding, perfect, and the crown was placed without any problem. It's been months. I haven't had any issues at all. I was very impressed with not only his ability, obviously, which was extremely professional, but his staff, his whole operation, appointments, follow-up, care was very impressive.
I brought my son in because he had to have his wisdom teeth taken out after braces were off. He had pain, he had impacted wisdom teeth, and he was recommended to have them pulled. So we came in to have his wisdom teeth removed. It was great. He was really afraid because a lot of his friends came home and took a couple of weeks of bleeding, infection, some issues here and there, but he was expecting those, and nothing. It was just extremely smooth, and he was very impressed. He thought he was really funny. He loved them, and the personality was fantastic. It made him, ease into, an operating room, and the staff was great. Afterwards, it was like being in a nice hospital setting. They took him into a recovery room, and they made sure that he's doing well. Besides doing a fantastic job, Dr. Abel doing that, and being very professional, I loved the staff. It was the first time I met Dr. Abel. I had heard fantastic things through other people, maybe like 20, 30 people that had come to him, and they recommended him. And I met him for the first time when I took Ryan in. And the staff was friendly. Afterwards, they called. Dr. Abel called to check on him, not just once, a couple of times to make sure he's okay. And then a week later, we came in, constant calls and checking, and friendly staff. So yeah, I recommend them.
You're really, really speaking wonderfully about how you take the extra time with each child. You really are compassionate. You communicate really well with the parents. You're doing great work. And we know, I'm being a father myself, how important it is and how much we worry about our children to make sure they have a good experience without any risks associated, and your practice is doing great work in that area.
Thank you for saying so, and I believe we are as well.
All right. So speaking of children, Dr. Abel, what age do children typically get their wisdom teeth?
The most common time that I'm seeing patients to evaluate whether they're a candidate to have the wisdom teeth removed, and we can go into the reasons why they are, is usually 15 and older, but there are certainly exceptions where sometimes we'll do younger. And there's sometimes some older patients where the development of those teeth is quite behind. But the most common age group that we treat for this procedure is between 15 and 21 years old typically.
And speaking of reasons, what are some of the most common reasons that children would need to get their wisdom teeth extracted?
So the most common reason is the teeth that are directly in front of them. So wisdom teeth can be referred to as third molars, and the teeth that are in front are the second molars, or the 12-year molars, meaning that's when they typically will erupt into the mouth. So to protect those second molars is the number one reason if someone is asymptomatic, meaning they have no pain or swelling or anything like that, is because over their lifetime they're at risk to get decay, periodontal disease, and bone loss and resorption of those good functional teeth that we want to keep forever. And the wisdom teeth are somewhat more expendable in the sense that teeth serve two purposes, which is to look pretty and to chew. No one cares what they look like, and they don't typically help us with our chewing too much.
What would you say, based on your expertise in dealing with children and being, a renowned oral surgeon in the community, what are some key tips or advice that you'd give to parents when it would come to dental care?
So this is across the board, both with what I do as an oral maxillofacial surgeon and dentistry in general, is having good preventative measures. So good routine follow-up with the general dentist or pediatric dentist to basically monitor any patient to see if there's any problem developing and nip it in the bud before it becomes a problem. So it's very, very common that I'll see some unfortunate circumstances where if a patient had been monitored more closely, something could have been picked up prior to them landing in my chair where I have to do something a little bit more advanced. So just like if going to your general doctor, to get your routine blood work and history and physical, same thing goes for the oral cavity and head and neck area, because it's more than just the oral cavity, but often the dentist will be evaluating the head and neck as well, and you can see some signs of some issues that you can nip in the bud and find early that can be way more treatable than if it goes further than you'd like it to be.
We touched on some reasons why children may need to have their wisdom teeth extracted. Can you tell us about what types of symptoms adults should look for, or more the general population?
Sure, and it can start as young, as when they're coming to be evaluated for the preventative removal of wisdom teeth before symptoms arise, but it's not uncommon that we get those symptoms at a young age. The most common reason is that when the wisdom teeth start to emerge from the gum tissue a little bit, oftentimes they get kind of stuck. And so you have some gum tissue that's still overlying a lot of that tooth, and that becomes a food trap, bacteria trap, and it's just impossible to clean. The patient can't do it, the dentist can't do it, I can't do it, and that gum tissue can get very inflamed and angry, and that's where it starts talking to us, and that's where I can answer it, and we can take care of it then. So anytime we start to get those types of symptoms, it's very important to reach out to the dentist or an oral surgeon to address it, evaluate it, see if it's something that urgently needs to be taken care of or it's something that can wait, but oftentimes we can do it very expeditiously.
Well, we definitely don't want to have angry gums. Not a good experience. A lot of pain involved. We all can relate to that.
Yes.
What is the patient process for when someone needs their wisdom teeth extracted, or they feel like they have the symptoms and then they come to your office?
Yeah, so when they come to see us, we can do it a variety of ways, in the sense that sometimes we can evaluate and do a same-day procedure, and sometimes patients choose to come in for the evaluation first, so we can go over everything that's involved, the reason why we do it, what to expect in the recovery, and then what to expect during the process itself. But regardless of whether we separate into a consult surgery or do it all in one day, the most common way to do is with IV sedation for the patient's comfort, but certainly if the patient's insistent on being awake, we can do it with just local anesthesia, or we can do it with local anesthesia and what we call laughing gas or nitrous oxide. And no matter how we do it, we can get the patient through it very comfortably. So the typical recovery, the bulk of it will be within a week, but the brunt of it is usually the first 2 to 3 days. That being said, it's usually not too uncomfortable. So I always relate to patients saying, on a pain scale of 1 to 10, 10 being the worst pain of our life, it usually peaks at a 4 or less in our practice. And usually by a week, we're friends again. And that's why I like to see them back in a week. Okay. And if we're not friends at that point, we got to figure out what's going on. But it's very rare. We're almost always friends.
That's great to know and to hear, because wisdom tooth extraction has come a long way. Mm-hmm. Patients used to experience a great deal of pain. Mm-hmm. The process was something that most people feared, did not want to endeavor. But with these advances and how you've described the process, it seems like it's come a really long way. There's much less discomfort. The recovery time is a lot better, much better patient experience. Dr. Abel, are there any side effects or issues that people can experience after they've had their wisdom teeth extracted?
Yeah, so the most common things we get, so everybody gets a level of some bleeding, some swelling, some discomfort, but it's all typically very well managed and tolerable. The bleeding typically will subside that day of surgery, and the swelling discomfort usually peaks 2 to 3 days later. And where we really pride ourselves in our practice is, we hear the countless stories where I see a patient or a parent, and they'll relate stories about people they know who didn't have a very positive experience. And it's just very rare that we get that. We're very efficient. It's one of the most common things that we do in our practice, probably anywhere between 400 to 500 cases a year. Some people have referred to a process called dry socket, which can be just a very painful recovery process after wisdom tooth extraction. It usually, presents itself 4 to 5 days after the procedure and can just be exquisitely uncomfortable. It's not an infection. It doesn't require antibiotics. It's just kind of a local measure of putting a medication in the site. They, depending on the study that is presented, it might be anywhere between 10 to 20% of lower wisdom teeth can get this process. In our practice, we probably get less than 2%. So it's very, very rare that I'm ever treating that process, and apparently we're doing something right that's keeping us from having to.
Well, you're definitely doing great work in the community. You're recognized as a top oral surgeon by Washingtonian, and you're really stay abreast of all the latest procedures and treatment options. Your practice has 2 locations conveniently located here in Chevy Chase, Maryland, as well as Washington, D.C., and you have some of the latest technology that you utilize that are all to the patient's benefit. Mm-hmm. Can you tell us a little bit about your vision for your practice, Dr. Abel, and what you feel makes you different and unique from other practices?
Yes, and pretty much everything that we do in our approach gives us all just incredible pride. The number one thing is our team, so there's certainly our doctors who we're very proud of ourselves in the way that we approach patient care, but our team, we couldn't do it without them, and we have a lot of people who are part of that team, and every one of them is integral for the patient's outcomes and our overall success. That's number one. That's the easiest part as far as what gives us pride. It's definitely not the easiest part to attain. It takes incredible amount of work and perseverance to create a team like that, and I'm just overwhelmingly filled with pride when it comes to that. And then on top of it, certainly our surgical training is top notch, and where we were trained, and then how we put those skills into action. And certainly, as you'd mentioned, keeping on top of cutting edge advances in technology, whether it's our 3D imaging capability, the types of instruments we use to perform our procedures. We have a variety of different devices to handle soft tissue. We have the highest cutting edge technology in laser treatment for soft tissue, and we also have a cutting edge technology to treat hard tissue that does not create any heat, so it can cut hard tissue without even cutting soft tissue. So we have those in our disposal, and then on top of that, it's the overall patient experience. So we can get the results, and we're very proud of our results. So anybody who's coming to see us to get an issue addressed, we're going to address it with the utmost skill, with incredible success rates, but it's all about how the patient experiences and perceives their time with us. So we always want to make sure that they come away with an overwhelmingly positive viewpoint on what they experienced with us, how they've recovered, and probably the most important part about that is communication. So before we even start that process, making sure the patient's fully informed on why we're doing it, what to expect when we do, and what to expect after, and always being available. So we are always available at the office. You can always get us. Outside the office, you can always get us. So every patient has my cell phone number. I call every patient the night of surgery, make sure they're doing okay. And that way, we can nip anything in the bud that needs to be taken care of before it becomes an issue, which it rarely does.
Dr. Abel, we covered dental implants, we covered wisdom teeth extractions as well. What are some of the other procedures that you offer here at your practice?
So we have a broad scope of procedures and issues that we deal with, so anything as simple as taking out a baby tooth to anything as more involved as doing jaw surgery or trauma surgery. So kind of walking it up, we take out baby teeth, we can take out what we call supernumerary teeth, which is not terribly uncommon in our practice, where some children will have extra teeth that are blocking the eruption of other teeth, so we can remove them at an earlier age. We take out wisdom teeth, we do our dental implants and dental implant associated procedures and reconstruction and bone grafting procedures or sinus surgery. Then going a step further, we deal with quite a bit of pathology, mostly benign pathology, but sometimes we do encounter, unfortunately, some malignancies. But we can do biopsies of soft tissue, being gum tissue or cheek tissue or tongue, and we can do biopsies of hard tissue, being the underlying bone structures. And sometimes we get something more involved where you can have some very aggressive cysts and tumors that can be locally destructive to the jaw bones. And so we can take those out and we can reconstruct them with bone. Sometimes something as simple as donor bone, but sometimes we can even take bone from other areas, whether it being the hip, the knee, or other areas inside the jaw itself. So for people who have gross malocclusions, being that their teeth don't meet appropriately and they can't be fixed with orthodontics alone by moving the teeth, sometimes there's a skeletal issue, and that's where we do something called orthognathic surgery or jaw surgery, where we can move the jaws in 3 dimensions to get the teeth and the jaws to align appropriately to both get proper function as well as proper aesthetics. We deal with TMJ issues or temporomandibular joint disease, mostly conservative management, but sometimes there is a surgical element that can help treat those issues as well.
So you offer the full spectrum of not only oral surgery, but the related treatment of options as well.
Absolutely, and there are even some times that trauma can be involved. This is not uncommon. It can be as simple as someone knocking a tooth loose or out, or fracturing part of a tooth, to facial fractures or soft tissue lacerations, and we can do head and neck full reconstruction in those circumstances as well.
Well, you're doing great work, as I mentioned earlier. Your patients love you. We interviewed several of them earlier as well, and the communication, they talked about your compassion and your staff and your professionalism and the great results that they get. You can't do better than that. So on that note, Dr. Abel, I want to thank you so much for joining us today, informing us about all these latest advances in not only dental implants, oral surgery, as well as wisdom teeth extraction. And we thank you again for being a guest. Look forward to having you on again in the future.
Thank you so much for having me. It was a pleasure.